Sure, and to prevent the next time, because, for example, there are some moms, they have a short cervix.
Yeah.
So those short cervix, they are at the risk to have a preterm babies.
Yeah.
So she will be followed up with her own obstetrician, so for the next pregnancy.
Yeah.
In fact, one of the things which we always advising parents is that the spacing between kids. You have to space, otherwise if you don't space between kids, and this comes as a recommendation from Allah subhanahu wa ta'ala, and the nature itself is that saying that you have to have a 2 years. 2 years for you to recover, and the 2 years to take care of that small kid.
Yeah.
Because if you're going to have a baby today, in 9 months you have another baby, you compromise yourself, and the risk that you may go into preterm baby is sky high. People may argue with you that in olden days, our grandparents, they used to have kids without spacing.
Yeah.
Sure, in olden days, the lifestyle is totally different. The way how they used to eat and to feed themselves is totally different from nowadays, the smartphone generation.
Yes. We have a question from our colleague, Dr. Dalal, the co-host of the show. It will take us back to the vaccination subject. Why does babies develop fever on certain vaccinations?
Okay, let me make it more simpler for our viewers, because I don't want to complicate things. Whenever you receive a bug in your body system, the immune system itself, it has to react, and part of the reaction is to have that temperature issues, because again, that virus or that vaccine, when it goes inside the body, it gives an alarm to our immunity or the host, which we are the host. So that host should have all the alarm system, including the white blood cells, including your thermostat, which is your temperature control. And in fact, alhamdulillah, that we do have a sign that I do have temperature. There are kids born, unfortunately, Allah subhanahu wa ta'ala created them, they are born without the temperature to go high or low. So many kids, they were into infections unnoticed, because there is no alarm system built in. The same thing, there are kids, they born without the pain as a sensation available there in their body. So it's ni'mah from Allah subhanahu wa ta'ala. It's really a miracle from Allah subhanahu wa ta'ala that you have to have that temperature thermostat, and you do have some pain, because if you are painless, sometimes you can't even put your hands in a hot water and don't feel it.
And is it a good sign that the baby developed fever? That means his body is reacting, or
it's not necessarily, because again it's another myth going on. Some moms, she comes to me in my office, Dr. Sulaiman, the first vaccination at 2 months, he didn't develop temperature. But the second one, he developed temperature. Does it mean that he was not reacting and that first dose was not right? I said, no, not necessarily. It's not necessarily you have to cope with the temperature. There are kids, they want to have temperature, which doesn't mean that he didn't have the right vaccine on the right time, so he should react to it. The same thing now, if at home you have a flu is going on. So if everybody at home, let's say 5 people there, one develop the flu, he catches the flu, and the rest the other 4, they didn't catch the flu. What does it mean? It doesn't mean that those 4 are having, their immunity is strong, but they react totally different.
Exactly.
So I think it's a good question. We have to understand it, but again, what I would like to enlighten more on this is that I have to send again another message. There is a misconception that once you get the vaccination, you have to go in a regular paracetamol to reduce the temperature in the face of the temperature if it goes up. I'm always saying for parents, don't start to overuse the paracetamol. Check the temperature every 6 hours. And if there will be a temperature, give paracetamol accordingly. If there is no temperature, because there are studies nowadays saying that kids receiving paracetamol the first year of life, they are more prone for bronchial asthma. In fact, I think a week ago, the American Medical Association, they just released an observation study saying that pregnant mom, if she misuse and use over of the paracetamol itself, she's putting her fetuses at the risk for a future asthma.
Wow.
So we have to be very careful. Paracetamol, it's although it's a safe drug, but misusing it, it can put our life and our offspring in danger.
Thank you, Doctor. We'll take a short break with this report and we'll be back to you.
From the Sulaiman Diabetes Institute, and today I'm going to be talking about hydration. So something we can all agree on is that it gets pretty hot in the Middle East, especially during the summer months. So people tend to lose a lot of water through sweat, breathing, walking around, and all this water needs to be replenished. Our bodies consist of around 70% water, and so most of our organs, like our kidneys, our brain, our lungs,
Welcome back. So, Dr. Sulaiman, we shall continue on the hot topics related to pediatrics.
Right.
Currently, the weather changes and people are getting more sick with the flu and other upper respiratory tract infections. What's your advice on such for babies?
Again, first of all, I'm always advising, it's a very common question that comes into us, that the first 3 months, what is the idea of taking a 3 months old to put him in the trolley and to go for shopping?
Yeah.
Especially the shopping centers that are not that clean enough, because we do know that people are not quitting smoking.
Yes.
And people are getting sick. So what will be the benefit for a 3 months old to go in a trolley? Of course, if they are, pushed to go, it's up to them. But if they can go by themselves and to leave the kid at home, I think it's the preferable choice.
Yeah.
The diseases nowadays, I think it's very important. Again, education is so important. People are not able to even to tolerate a little bit of a low fever, and with a little bit of a stuffy nose or a cough. Don't rush immediately, especially when I'm talking about any kids more than 6 months of age. This 6 months of age and less, they need to be seen and evaluated by a pediatrician, not to be left for anybody. How we have to deal with the temperature is very important. Always give yourself that if only the fever started with the kid, with nothing except a fever, start to check the temperature. I think it's very important for each and every single house. They do have the temperature thermometer. And to check the temperature. And to check the temperature in both ears, just to make sure that, sometimes the thermometer has some variations. So a temperature, and then start to take off the clothes of the kids and use a towel, put it with the tap water and just rub the baby with it. Give them half an hour and check the temperature. If it goes down, well and good. Otherwise, you can start to give him the paracetamol. And you have to choose the best paracetamol for the kids, for his age and his weight. This is the first aid type of steps before we rush for the hospital or for the polyclinic. Because give yourself 48 hours. Again, my message is that 48 hours only for a temperature. But if there was a temperature and the kid is unable to awake, or the kid is unable to eat, and he looks a little bit dehydrated, no, you have to put him in the car and to go to the nearest polyclinic or hospital.
So this is the warning sign.
Yeah, warning sign. If it is only a fever, give yourself a 48 hours by doing the tip sponging and using the paracetamol every 6 to 8 hours. And try to avoid the suppositories if you can, because some kids, they cannot take anything orally when they get sick. So we can use the suppositories. But try to be away from the suppositories. And if the temperature starts to be less than 38.5 or start to be spaced, this is a good sign. But if the temperature persistently still there, in spite of your paracetamol and tip sponging for 48 hours, you have to go to visit the physician or the pediatrician. But the warning sign, as I did mention, again, one of the warning signs is that a temperature in less than 3 months of age, you shouldn't play with the kid. If the kid is not able to take orally well, or if he or she are vomiting or having a loose motion, you have to go to a nearby pediatrician. Again, a fever with a skin rash, with a kid who is unable to eat, you have to go to the nearby hospital or a pediatrician. So those type of warning sign or alerts, red flags. Otherwise, we can deal with the fever. Cough, runny nose, in a normal kid, we can't tolerate them. Because again, it's a warning. Less than a year, any antihistamine drugs shouldn't be used.
Excuse me, doctor, we have a call from Saudi Arabia, from Abdurrahman.
Hello.
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 Sulaiman.
هلا معك.
Hi. Hello. Good evening, Dr. Sulaiman. How are you?
Fine.
Yeah. Dr. Sulaiman, just I want to ask you, I have my kid who gets recent vaccination and then he developed kind of fever.
How old is he?
He is actually 2 years now.
Sure.
Yeah. What I have to do? What's the step I have